So a little bit about some sensitive topics. Alcohol and drugs. These can be sensitive. It's easy to kind of just ask about it though. Hey, do you drink alcohol? Okay. How often? How much? You know? And you can usually tell most people, if they are comfortable with it, they'll be very straightforward with their answers. If they're not, then you can certainly have some concerns for the validity of their answers. But it's not really a big deal to ask about alcohol because it's legal. Drugs gets to be a little bit more touchy. Some people are not going to admit to that, especially if they feel that you're going to tell the police. So it's helpful to say, hey, look, I'm not going to tell the cops. I just need to know to tell the doctors. Have you had any illegal drugs? Have you taken anything? I want to make sure I can treat you to the best of my ability, but I really need to know if you've taken any drugs. And some people will be straightforward, and some people will lie even in the face of a drug screen that the doctors hand them at the hospital. But if they're honest with you, it's nice to know that. So physical abuse and violence can also be sensitive topics. They can stir up emotions in patients, and then you end up with a very emotional patient on your hand. Another thing that is sensitive, but it is something we have to ask about in certain cases, is sexual history. This can become embarrassing when you're asking a 13-year-old if she's sexually active in front of her parents. 13 is, in fact, old enough to be pregnant. And in that case, you need to ask, is there any chance that you're pregnant? And it may require you to go into a little bit more depth about how do you get pregnant if that person is not familiar with that. So make sure if you're asking about sexual history that it's kind of a one-on-one questioning and that you can explain why you need to know. Some patients are especially challenging. The silent patient, this is tough because you don't get any information out of them. The overly talkative patient is tough because it's hard to direct them. So you have to be directive with these people. Oops, directive. The silent patient, you just have to ask a lot of yes/no questions. Patients with multiple symptoms. I find it helpful to figure out what is the chief complaint. So which is the worst? Anxious patients, giving them some control over what's going on. Would you like to sit on the stretcher or in the chair over here? If that's an option. Or, give them the oxygen mask to hold instead of strapping it on them. Here, why don't you hold this? It's going to help you breathe, okay? Take some deep breaths. And then you're going to coach these guys too. So kind of coach them through everything that you're doing. Look, here are my concerns. Here's what we're going to do. I'm going to, take your blood pressure, and I'm going to take your pulse, and then we're going to take you to the hospital. So coach them and communicate with these patients. You should always communicate, but anxious patients need a lot more communication. And they need to be able to ask questions as well. Angry and hostile patients, I think the key here is keep cool yourself. Keep your own cool. So be calm. Explain what you're trying to do, explain how you're trying to help, and how their cooperation is going to be the best option. If they are perhaps under the influence of some substances, you may need to get PD involved. And you can consider actually calling for ALS for chemical sedation if you can't physically sedate them. The intoxicated patients, well, these are very widely. People react very differently to alcohol from person to person. So some people may be giggly and silly, some people may be angry, some people may be depressed. And it really all just depends on the patient. So just handle them kindly and with respect. And if they're intoxicated, have an emesis bag ready. Emesis equals vomit. And we don't want vomit in the back of our truck, so have an emesis bag ready for your intoxicated patients. Your sad, crying, and depressed patient, these may be some of the hardest ones because sometimes you end up asking questions that get them thinking about what was making them upset in the first place. So I think it's helpful to kind of identify up front, what is it that has them so upset? Is it a relationship thing? Is it a family thing? Is it a work thing? And then kind of try and, if you can avoid questions about that, then, don't bring it up. You still have to try and get a history from them, though. Other challenges, if you have a patient with limited cognitive abilities, either naturally because you have a 2-month-old, Or you have somebody who has maybe a lower than normal IQ, where they have a learning disability. They're more difficult. So you just have to kind of play it by ear. You can use guardians to help get history. But we'll talk about ways to interact with people of lower cognitive abilities. There's a language barrier. This is tough. There's a lot of kind of interpretive dances, I think, that go on with language barriers. You can also, depending on where you work, get hooked up with like a language line interpreter type thing. Hearing impairment, I think this one's not too bad because you can just write it out as long as they can see and write and read. And then visual impairment, also not too difficult. You know, you can still usually communicate with them. It's when you have both of these that things get tricky. So you guys can certainly think of some other ways to address these issues, I'm sure. So I'm going to move into the secondary assessment, and this is really kind of a physical exam. We are going to practice this in class. You are going to be touching other people. That's part of the job. So kind of get used to the idea of touching other people, appropriately, of course. So the general approach here is that we're going to examine our patients systematically. Your physical exam really should be the same on every patient. The exception to that might be a kid. So your kid exam should be the same on every kid, and your adult exam should really be the same on every adult. You are, however, going to place some special emphasis on areas suggested by the present illness or chief complaint. So if they have abdominal pain, you're going to focus on the abdomen. If they have an extremity injury, you're likely to focus a little more on the extremity. But that doesn't mean that you don't assess the whole person. This is most patients don't like this part, and I don't know that they're going to necessarily be negative about it, but it's just awkward. You have this person who's a complete stranger coming up and saying, hey, I'm going to push on your stomach. You know, it gets a little weird. That said, they did call you for help, and it is part of your job to do a physical exam on your patients. Maintain professionalism. Use appropriate words. So if you're talking, you know, if you have a large-breasted woman and you need to kind of assess the ribs or something underneath her breasts, then say, ma'am, I'm going to need to lift your breasts out of the way. Generally speaking, when you use appropriate terms, it's not really a big deal. Let me finish writing that there. And then be compassionate. You know, we're going to practice on each other, and part of that is understanding what it feels like to have someone who's basically a stranger touch you. And it's not touching you inappropriately, it's just touching you to examine you and get information. So we have a focused exam versus a detailed, which is a head to toe. You're going to categorize them basically which patient gets which, either a focused or a head to toe, based on the complaint. So a focused exam is focused in on a particular area. A detailed exam is one that looks at all of the details from head to toe. A respiratory patient, for example, is likely to get a focused. So focused, and the reason that it's focused in on all of the stuff that's pertinent to respiratory. You don't need to necessarily palpate somebody's head, meaning touch somebody's head, if they've got a respiratory complaint. But that doesn't mean that you're going to just focus on the lungs. It's going to be focused on everything that could possibly be associated with respiratory. Same thing with cardiovascular. It's going to be focused, usually. Neurological, that is more likely to be kind of your head to toe, because we have nerves all over. Nerves go from our heads to toes. And musculoskeletal, and this kind of depends. Is it one area, which is going to be focused, or is it a multi-system? Is it your arms and legs and abdomen? If it's one area, like I just kind of rolled my ankle and then I sat down, then that's going to be a focused. A multi-system is going to be detailed.